counties that voted for you, middle-class and working-class counties, would do far less well under this bill.
A lot of things aren't consistent, but these are going to be negotiated. We will take care of our people, or I'm not signing it. Okay, just so you understand.
Possibly mixed messages from President Trump, who says he's 100% behind the bill, but also it's up for negotiation and maybe he won't sign it. Could it be that his heart is not in the fight? Let's talk to our panel about all this. We have with us CNN political commentator Bakari Sellers, Republican Congressman Marsha Blackburn of Tennessee, former White House Communications Director Jen Psaki, and Jim DeMint, president of the Heritage Foundation. Thanks so much for everyone for being here, and welcome. This is your first appearance here, and yours as well.
Thank you.
How to interpret what President Trump just said in that clip with Tucker Carlson with what Tom Price said earlier in the show? He's saying President Trump granting the point that his voters will do worse under this bill. Tom Price obviously selling rainbows and sunshine.
The president's definitely in this. I know Marsha's been at the White House, and I have too. He's very engaged, very open to improve the bill, but he is very supportive of the idea of getting this repeal through. The first part of every conversation you have with him is how destructive Obamacare has been to our healthcare system. So he's ready to listen to improvements, everything we've talked about. I think Marsha and Chairman Walker got some improvements last week, but he's very supportive of getting this bill through.
What do you think, Jen, when you watch the president's talk compared to what Dr. Price just said?
Well, he didn't really have a choice when he came in. He had to satisfy the ask of the Republican base to try to push for this.
The repeal.
The repeal.
Yeah.
Now, the question becomes, as he looks at the details, as many in the public are looking at, of what the alternatives are and what it would mean in terms of taking health care away from people, poor people, people who really need help, is this something he's really going to stand behind? And we haven't really seen, I wouldn't say confidently that he's going to do that because Obamacare has become more popular. It's something that it's health care in America today. It shouldn't be a partisan issue, and that's how you're seeing it play out in a lot of states across the country.
So, Congressman, let me ask you, because one of the things that you have always told us about, that you like about President Trump, and clearly enough Americans agree, is that you know where he stands on issues, you know how he feels about issues, he says what he says. Listen to President Trump talking about whether or not health care should have been his first priority. This is just from the other day in your home state of Tennessee.
Finally, I want to get to taxes. I want to cut the hell out of taxes. But before I can do that, I would have loved to have put it first, I'll be honest.
He would have loved to have put it first. He would love to be debating tax reform right now and not health care reform.
Yes, but you take the thing that you promised, and it was to repeal Obamacare and clean this situation up. The market is imploding. It is not sustainable. We have 1/3 of the counties in this country with one provider, another third with only 2 providers. And so, Jake, you have to do it. It's a heavy lift, yes. Do you need to sometimes hit the bad news and the heavy lift first? I think so. And
Can I ask you just a question? Why does everybody say, Republicans say this, that the market's imploding and then it's not sustainable, it's in a death spell? According to the CBO and according to Standard & Poor's, that's not true.
I can tell you why they say that.
Do you after her?
Yeah, and you can look at the escalation in the rates, you can look at the mandated benefits, what it is causing, and you can look at who is going in and providing health care. I've met with my insurance companies. What do they say? This insurance marketplace in the individual market, when you have 1/3 of the counties in the country with only one provider willing to offer the product that is there, that is a problem. Now, the goal is to have everyone with access to affordable health care. The president understands that. You can go back to the Blair House Healthcare Summit, February 25th, 2010. We laid out a private sector approach. The Democrats laid out a government approach. We tried theirs. It didn't work. Let's do something differently.
To answer your question directly, the reason that Republican leadership and the reason that the President of the United States are parroting this talking point that Obamacare is in a death spiral is simply because an insurance CEO, the CEO of Aetna, said this. By the way, he made $17 million, and the sweetener that Congressman Blackburn and the Republicans and GOP leadership have put in for healthcare CEOs, where they can deduct income over $500,000, means that they're going to be able to parrot more of these talking points. The fact is that the Obamacare premium, the Obamacare premium increases the Obamacare premium increases that we see, we know need to be fixed. Any Democrat will tell you that. But it affects 3% of the population. The fact is, Congressman Blackburn, her Republican colleagues, led by Paul Ryan, have put out a bill which is going to hurt the low income, the disabled, women who are bearing children. 24 million people are going to be kicked off of health insurance.
That is incorrect.
Well, I'm just quoting the CBO.
Those-
Well, 24
but those
million,
numbers are not-
some of the 24 million will
not
choose to
correct.
not have health insurance.
Well,
That is
that-
one of
okay.
them.
So-
You're allowing some people to have some freedom and some choice. And what we know is Obamacare with the mandates has not worked.
But-
It has driven
So explain
the
to me
price of
this,
health
because you say
insurance
you
up.
say the mandate, but
It's
explain to
driven
me
it
this,
up.
because you eliminate the tax. However, individuals who choose not to get insurance, they then have to pay a 30% deductible for the next increase in their deductible for the next 2 years. So although it's not a tax to the government, the people that win in this are insurance companies.
What you have to look at is what is happening right now
People
in
have
this
insurance right
marketplace. Bakari, they cannot afford to use it, and that's a false hope. That's the biggest complaint we get in our office. The insurance is so expensive, they can't afford it without a subsidy. Out of the 9 million people that are in the marketplace, only 2 million buy it without a subsidy. And then it just breaks my heart to hear from people they cannot afford it because their deductibles are $6,000, $10,000, $12,000.
We have to take a quick commercial, but I want to ask you, prediction for Thursday, is this going to pass?
Not without improvements.
Not without improvements.